We're going to pivot a little bit and talk about appetite suppressants or medications for weight loss. So the learning objectives are to understand the mechanisms of action of pharmaceutical agents for obesity and their efficacy at weight loss, learn the most common adverse effects of these agents, and then to determine when to start an appetite suppressant in a patient with obesity. And I'll start by saying that appetite regulation is just very complicated. It's not a simple process. There are peripheral signals which then need to be coordinated centrally. There's multiple areas within the brain that are affected. And so it's a complicated system that we're luckily learning more about, and that's helped us design medicines that can affect appetite. Some believe that obesity is a result of a faulty reward circuitry. And so the evidence for that comes from just knowing how dopamine works in the brain. So dopamine is released in the brain in response to caloric intake. And so if you have a good dopamine response, you tend to then be satisfied and eat less. But if you don't have a good dopamine response, it might take more food for you to get satisfied, for example. There's also been studies that show that the neural pathway in obesity is similar to processes in addiction and compulsion. And so patients' eating behaviors are similar to that seen in other with other addictive substances. And then from a pharmaceutical standpoint, substances that increase dopaminergic activity, such as monoamine oxidase inhibitors, do decrease hunger and intake. And so it's a result of all of these types of information that then became natural targets for pharmacotherapy for weight management. So the first thing to say is that these are the currently FDA-approved weight loss medications in the long term. And except for the first one, which is orlistat, the others are all appetite suppressants. You can see that up until about 2012 or so, there just weren't too many good options for weight management. There were a couple of medicines that are not listed here that were pulled off the market because of safety concerns. But it's really since about 2012 that we've had a reasonable amount of or reasonable choices when it comes to helping patients with weight management. And again, these are all appetite suppressants. We do not have a medication that changes metabolism.